Welcome to the next episode of the MB2 Underground podcast. I am your host, Joe Fox. Super psyched to have another great guest on the podcast, general dentist in Phoenix, Arizona, Dr. Brandon Harris. Welcome, sir.
Yeah, thanks for having me. I appreciate it.
Thanks for being here.
Yeah.
And giving up vacation time in beautiful, sunny Coronado, California to come chat and hang out with us.
Yeah, it is a beautiful place. It's hard to leave, but
it's unreal.
Anything for you.
Yeah, appreciate it, man. So this podcast is all about entrepreneurship, leadership, business, economics, kind of all the things you've done and continue to do and have had to navigate kind of over time. But and so I got some questions just to understand your business and kind of how you did what you did. You've got a very unique, cool story. But before we get kind of into that serious stuff, I've got to ask you, who is a better roommate, Dr. Johannes Meyer or your fiance?
Ooh,
Be careful here.
Yes, it is a pretty close one. I do got to give it to my fiance because she is a fantastic cook. Yeah. But Jeff was a pretty good time.
I love it,
Dr.
man.
J. Yeah.
That's super cool. Does Dr. J just break out into the Star Spangled Banner in the shower? 'Cause that was a pretty impressive performance.
That was the first time I've heard it. When he went up there to go sing, my table, they look at me, they're like, does this guy sing? And I was like, no, he doesn't. And then he's got some pipes on him. That was pretty impressive.
Pipes, man. Oh, that's a trip. Okay, one other fun question. You said you're a college football fanatic.
Yeah.
So I've got to ask you some tough questions here.
Yeah.
Current best college football program, and then best college football program of all time.
Okay. Current best college football program, it's got to be Arizona State University with Coach Dillingham.
Really?
That's my alma mater, and I'm sticking with it. And, best program of all time, I don't know, just growing up with Alabama being pretty dominant, or actually USC, with the Reggie Bush era and everything.
That's some great years.
Yeah.
Yeah, that's a tricky question. It's tough, but
I'm sticking with Arizona State, though.
I love it.
Go Devils, baby.
Good deal. Good luck, Sun Devils.
Yeah.
Good luck. Awesome. So your path to practice ownership was very unique in the sense that it was very quick.
Yeah.
Can you kind of walk us through how that happened?
Yes, I can.
Timeline?
So right when I graduated dental school in 2019, I wasn't really looking at MB2 too much. I was really just looking for somebody who practiced the way that I thought I wanted to practice, and it happened to be an MB2 practice with Dr. Garth McCaffrey.
Interesting.
And so,
what were you looking for? What was it when you say the way that he practiced?
Yeah, well, I was looking at doing more comprehensive dentistry. Dentistry where it was just kind of looking at everything, and kind of full mouth rehab cases, stuff like that. And I wanted to find somebody who was kind of doing that. And that's how I found him, and was a associate there at a practice called Fox Family Dental. And I was the only dentist there right out of school for 2 years. And I felt like I got a lot of good experience, but I was eager to be a partner with MB2. And so that's kind of how that unique opportunity came, and MB2 actually found this practice that I'm currently in right now.
How cool.
Yeah.
So where do you think that eagerness to be an owner came from? Right? Is that something that you just have always had?
Yeah,
or?
It was kind of ingrained to me even in dental school. There was actually this one podcast that I listened to quite frequently, and they were just talking about all the benefits of practice ownership, and running things ultimately the way that you wanted it to. And I had some ideas on how I wanted my practice to be ran, and that's one of the biggest reasons why I wanted to do it.
So you just knew you wanted to do it. That's fantastic.
Yeah.
That's fantastic. And so how did that opportunity come to you exactly? There was a practice MB2 encountered?
So MB2, they bought this practice in the Biltmore area in Phoenix. Yeah. And they were looking for a doctor because he was leaving in about 3 weeks. And so Justin Puckett, he emailed me, and I was looking at everything. This practice was everything I wanted, in terms of the type of dentistry that they were doing. So I had to say yes. So
awesome.
Yeah.
Fantastic. Yeah, Biltmore's a pretty unique, special area. Tell us more about kind of where in Phoenix this is.
Yeah, so it's like probably 15 minutes west of Scottsdale, but the Biltmore is a pretty unique practice or just area because a lot of the old money in Phoenix live there, so it's a pretty unique situation that I'm in, and I'm very grateful for it.
Wow, that's awesome. Man.
Yeah.
That's awesome. So tell me about your you're a young dentist, right?
Yeah.
Relatively new dental school graduate and been an owner for now multiple years, but you're continuing to kind of push the bounds in terms of education, right? So tell me about the American Academy of Clear Aligners, the AACA.
Yeah.
And what that has done for you from a clinician's perspective and an owner's perspective, and the value you found there.
Absolutely, yeah. When I went, so one of the biggest things I went to was Dr. Galler's course, that re-engage course over in Vegas.
You're Galler, right?
Yes, exactly. And but I actually did this other course called Molus as well. So those two people were pretty instrumental in me doing what I'm doing with Invisalign right now. And bringing that to my practice has totally transformed the way I practice every day. And personally, I think, and again, I don't work for Align or anything like that, but if you're not doing Invisalign, I just feel like you're leaving a lot on the table.
Yep. Because
there's a lot of people who have problems that we were taught in dental school that night guards would be, the solution to that. When really, if you fix their bite with Invisalign, not only is it so satisfying, but it could be pretty lucrative as well.
Wow.
And so it's totally changed the way I view pretty much everybody who walks into my practice now.
Wow.
So that's kind of, again, just another thing I'm very grateful for.
That's awesome. And what level of Invisalign provider are you right now?
I'm a platinum right now.
Wow.
So that's about doing 65 cases every 6 months. I probably have around 100 or so current cases that I'm working on right now that people are on Invisalign. And it's actually what I really love to do.
Yeah.
And the before and afters and everything is something that is very satisfying.
Yeah, absolutely. Is Galler's program and Molus, are they competitors of sorts, or are they complementary, or how do you view that?
I view it as complementary, and I really do. And what I've learned from them, I've actually also, there's a third person that I've learned from, which I did dedicate a lot of my career to, is actually John Coyce over in Seattle at the Coyce Center. So using his comprehensive teachings with their very straightforward approaches with Galler and Molus, really, I feel like I'm able to do these cases on really whoever comes to the door. Feeling pretty confident with that.
Tell me more about the Coyce Center. What is the approach? What's so special and unique about it?
Yeah, so the Coyce Center, there's dentists from all over the world who come and take these courses from John Coyce. And John Coyce has been a practicing dentist for over 30 plus years. And he's got a very science-based approach. I could probably do a whole podcast on the Coyce Center, but the mentors and the people that I've met through these courses, like some of the best dentists in the world, quite literally. Wow. And, he's just, his approach to dentistry, he's always innovating constantly, and he's always trying to take it to the next level. And I actually graduated from the Coyce Center back in November 2022. So probably one of my biggest accomplishments to this date.
Congrats.
Yeah, thank you.
That's fantastic. That's fantastic. Are there new techniques or new technologies that you're really excited about? Again, you've got some great mentors, and it sounds like you're always looking. You're always trying to push the bounds of your growth.
Exactly, so. And I think one of the biggest innovations right now is going to be the 3D printing. And so there's actually this 3D printing dental Facebook group that I've learned all my 3D printing from.
Really?
Yeah. So there's this printer for $350 that you can get on Amazon that this guy in Florida found, And so instead of buying like a $12,000 printer, a dental printer, you could buy this $350 printer that prints just as fast and just as accurate. There is a learning curve to all this. It took me a while, a lot of trial and error. But that's one of the things I'm working on right now.
So if you're willing to put in the time, how does that disconnect exist, 350 versus 12,000? Is it just a emerging technology and it's kind of how it always starts? Or?
Yeah, well, this technology is starting to catch up. Everything's starting to catch up with that. So you can buy very inexpensive printers that will get you the same results.
Interesting.
And so that's something that I think is really cool.
Yeah, super
personally.
Cool. Now, what are you going to be printing exactly? Like, what are you going to use it for?
Yeah, so let's say that if somebody wants veneers, I can do a scan of their mouth and digitally design their veneers and put a mock-up in their mouth so they could see pretty much exactly what it's going to look like.
Wow. In almost real time.
Exactly, yeah. And, you know, anything from night guards to, you know, pretty much anything. You could print anything. I was actually printing, I was a little Dragon Ball Z fanatic when I was a kid, so I was printing these Dragon Ball Z figures on my desk, so when my staff comes into my office, they know that with all these little figurines that I got, that I've been doing some printing over the weekend.
I love it.
Yeah, so just stuff like that keeps it fun.
Yeah. And again, technology is such now that you've got forums, so folks from throughout the country, throughout the world that are sharing this information, right?
Yeah.
That's pretty special.
It is pretty special. It's pretty cool with, you know, because all the information is out there.
Yeah.
And it's just, if you want to learn something, you just have to kind of dedicate the time. But it's all out there, so it's pretty cool.
That's super cool. Do you enjoy teaching other clinicians? Again, you're super young,
yeah.
But like you just offered an Invisalign CE internally, right, for the MB2 partners?
I did, yes. And I actually really do enjoy teaching. And even though I am young, I feel like I have dedicated a lot of my time to learning my craft. And so I'm actually working with MB2 right now on this thing called TPS. It's the treatment service provider or treatment provider service, where I help doctors with their clin checks. You know, so they'll send them to me, and when doctors send me clin checks, instead of just me doing everything for them, I try to give them a full narrative of what my thought process is and why I made the changes, so they could learn themselves. Because ultimately, you know, I'm trying to teach these people where they don't need me anymore.
Yeah.
And I just think I could bring a lot of value in that, because I've seen, you know, obviously not as many as other doctors, but from what I've learned at the Coy Center with Galler and Mullis, and combining all that together, I feel like I could bring a pretty unique perspective on some of these cases.
Yeah, it's super fascinating.
Yeah.
Teaching them how to fish instead of just giving them the fish, right?
Exactly.
That's special. I think that's always the best education approach, is that goal of letting the student kind of flourish and fly right on their own, instead of kind of having that more of a oppressive, like, you will be beholden to my lecturing.
Exactly.
Wow.
Yeah.
No, that's awesome. So we talked about some of the really cool opportunities in dentistry and the cool technology techniques that are coming out. What do you think are going to be the biggest challenges for the industry in the next, call it 10 to 15 years?
Yeah, well,
because you're going to be around, you're going to be dealing with that.
Well, particularly, I think it's going to be a little bit challenging for some of these younger dentists. I think I was at a dinner last night, and some of these schools, like even in New York, I mean, plus living expenses, you're looking at $750,000, $800,000.
Unreal.
And in my opinion, it's going to be really hard to pay that off just as an associate. And you are going to need to try to own a practice, and buying a practice with certain interest rates that they're on, it's just going to be very difficult. And that's what I personally foresee. And obviously, I think that's where MB2 brings a lot of value in that as well. Specifically in my situation, when they helped me find that practice, you know, they were instrumental with helping me take this business and take it to the next level. And I don't know, I was 28 years old when I first partnered with MB2. Actually, I think I was 27 turning 28. And there was so much that I didn't know, and they really helped me bring my practice to the next level that I don't think I could have done by myself.
Yeah.
So that's what I foresee some of these newer graduates, you know, running into, for sure.
Yeah, I mean, somehow the cost of education way outpaced like the income opportunity set for graduates. I don't think it's only dental, but yeah, that creates a unique challenge, a unique problem, and and a unique opportunity. Like you're a great example of that, right?
Yeah.
You pop in with a young tech-minded approach, and really cool things can happen.
And that's where, again, I think I could bring some value in some of these younger dentists as well, that if they're kind of getting burnt out, or they're trying to find something to reignite their passion for dentistry, some of the things that I've done in my career early on still have me motivated to this day.
That's
like
awesome.
I really like practicing dentistry, because it's just some of these comprehensive cases that we're doing are very, very satisfying.
Oh, I bet you're changing people's lives, right? That's really special to see that.
Yeah, so I'm having a good time with it.
That's fantastic. I mean, that's winning in life, right? You have a blast at your job, and it doesn't feel like a job, then
exactly.
That's the secret sauce. Awesome. So one question we love to ask every guest is, what is your favorite or craziest patient story of all time?
Man, craziest patient story of all time. Man, I'm trying to think.
Or it could be most fulfilling as well. I mean, it sounds like you have quite a few of those.
Yeah. Actually, now that I think of it, I have a good one. So one of the reasons why I wanted to take all these courses at the Koi Center and learn how to do these really hard cases is because I knew I was going to have to work on my dad one day.
Really?
Yeah. So my dad, his teeth were getting pretty bad in terms of how small that they were getting. And in order for me to figure out how to do this, I had to take the Koi Center to figure out how to treat him, because they don't teach you how to do that in dental school.
I bet.
And so my dad flew out to Arizona, and he was one of the first rehabs I ever did. I think he was in the chair for a total of 20 hours.
No way.
Yeah, for that one weekend. Yeah, and then I got him in on a Saturday. I had my now fiance. She was assisting for me and suctioning for me, and I was telling her what to do because she had literally no idea what to do. Doing a full rehab on my dad.
Wow.
But it ended up turning really nice, and his teeth look great to this day.
Oh, that's fantastic.
But that was probably one of the most fulfilling and coolest patients I've worked on, and it happened to be my dad.
Oh man, that's special.
Yeah.
That's special, Dr. Harris. Awesome. Well, listen, thank you for taking the time to chat. We
Absolutely.
really appreciate it. You got a really cool story, and I know our listeners will love to hear the story. So awesome. Well, we'll have to have you back. Awesome. Listeners, thank you so much for joining most recent episode of the MB2 Underground podcast. We will catch you next time.